Addison's disease, a disorder in which the adrenal glands do not produce enough hormones, causing fatigue, weakness, and other symptoms. Angina, chest pain or discomfort that occurs when the heart muscle does not receive enough blood and oxygen. Anthrax, an infectious disease caused by the bacterium Bacillus anthracis, which can cause skin, lung, or intestinal infections. Asthma, a chronic respiratory disease that causes inflammation and narrowing of the airways, leading to breathing difficulties and wheezing. Autonomic dysreflexia, a potentially life-threatening condition that can occur in people with spinal cord injuries, characterized by a sudden increase in blood pressure and other symptoms. Basilar skull fracture, a fracture in the bones that make up the base of the skull, which can cause a range of symptoms depending on the severity and location of the fracture. Buerger's disease, a rare disease that affects the blood vessels in the arms and legs, causing pain and tissue damage. Cardiac tamponade, a medical emergency in which fluid builds up around the heart, preventing it from functioning properly and potentially leading to cardiac arrest. Celiac disease, an autoimmune disorder in which the consumption of gluten leads to damage to the small intestine, causing a range of symptoms. Cholecystitis, inflammation of the gallbladder, which can cause pain and other symptoms. Chronic obstructive pulmonary disease, COPD, a group of lung diseases that make it difficult to breathe, including emphysema and chronic bronchitis. Cushing's syndrome, a disorder in which the body produces too much cortisol, a hormone that regulates a range of bodily functions. Diabetic ketoacidosis, DKA, is a serious complication of diabetes that can occur when the body produces high levels of blood acids called ketones. It most commonly occurs in people with type 1 diabetes, but can also occur in people with type 2 diabetes. DKA typically develops when the body does not have enough insulin to properly use glucose for energy, and instead begins to break down fat for energy, producing ketones as a byproduct. Symptoms of DKA include high blood sugar levels, excessive thirst, frequent urination, nausea and vomiting, abdominal pain, rapid breathing, confusion, and loss of consciousness. DKA is a medical emergency and requires immediate treatment with insulin and fluids to restore normal blood sugar levels and prevent complications such as brain swelling, kidney failure, and coma. Diabetes, a metabolic disorder in which the body is unable to properly regulate blood sugar levels, leading to high levels of glucose in the blood and potentially serious complications. Diabetes insipidus, a disorder in which the kidneys are unable to properly regulate the balance of water in the body, leading to excessive thirst and urination. Dumping syndrome, a condition that can occur after gastric surgery, in which food moves too quickly through the stomach and small intestine, causing a range of symptoms. DVT, deep vein thrombosis, a blood clot that forms in a deep vein, typically in the legs, which can cause pain, swelling, and other symptoms. Emphysema, a type of COPD characterized by damage to the air sacs in the lungs, leading to difficulty breathing. Epiglottitis, inflammation of the epiglottis, a flap of tissue in the throat that helps prevent food and drink from entering the trachea. Fat embolism syndrome, a condition in which fat droplets enter the bloodstream, potentially leading to a range of symptoms including respiratory distress and neurological problems. Hirschsprung disease, a congenital disorder in which nerve cells are missing from parts of the large intestine, causing difficulty passing stool. Impetigo, a bacterial skin infection that causes red sores or blisters. Intussusception, a medical emergency in which part of the intestine folds into itself, potentially leading to obstruction and other complications. Malaria, a parasitic infection transmitted by mosquitoes that causes fever, chills, and flu-like symptoms, and can be life-threatening if left untreated. Meningitis, inflammation of the meninges, the membranes that surround the brain and spinal cord, which can be caused by bacterial, viral, or fungal infections. Migraine, a type of headache characterized by severe pain, often accompanied by nausea, vomiting, and sensitivity to light and sound. Myasthenia gravis, a disorder in which the immune system attacks the receptors that communicate with muscles, leading to muscle weakness and fatigue. Myocardial infarction, a medical emergency in which a blockage in the coronary artery leads to damage to the heart muscle, potentially causing heart failure or other complications. Pancreatitis, inflammation of the pancreas, which can cause abdominal pain, nausea, and other symptoms. Parkinson's disease, a neurodegenerative disorder that affects movement, characterized by tremors, rigidity, and other symptoms. Pernicious anemia, a type of anemia caused by a deficiency of vitamin B12, which can cause fatigue, weakness, and other symptoms. Pyloric stenosis, a condition in which the opening between the stomach and small intestine becomes narrowed, potentially leading to vomiting and other symptoms. Pulmonary embolism, a medical emergency in which a blood clot travels to the lungs, potentially causing respiratory distress and other complications. Reyes syndrome, a rare but potentially life-threatening condition that can occur in children who have recently had a viral infection and are given aspirin, leading to liver and brain damage. Rheumatic fever, a condition that can occur after an untreated strep throat infection, leading to inflammation and damage to the heart and joints. Huntington's disease, HD, is a genetic, progressive neurodegenerative disorder that affects muscle coordination and leads to cognitive decline and psychiatric problems. It is caused by a mutation in the Huntington gene, which leads to the accumulation of toxic proteins in the brain, resulting in the death of brain cells. Symptoms of HD typically appear in midlife and worsen over time, and can include involuntary movements, personality changes, and difficulty with speech, swallowing, and walking. There is currently no cure for HD, but there are treatments available to manage symptoms and improve quality of life. Rubella, a viral infection characterized by a rash and other symptoms, which can be dangerous for pregnant women and their unborn babies. Syphilis, a sexually transmitted infection caused by the bacterium Treponema pallidum, which can cause a range of symptoms including sores, rashes, and neurological problems. Tetralogy of Fallot, a congenital heart defect characterized by 4 specific abnormalities in the heart structure, which can cause cyanosis and other symptoms. Ulcerative colitis, an inflammatory bowel disease that affects the lining of the colon and rectum, causing abdominal pain, diarrhea, and other symptoms. SIAD, syndrome of inappropriate antidiuretic hormone, a condition in which the body produces too much antidiuretic hormone, leading to a range of symptoms including fluid retention and electrolyte imbalance. Guillain-Barré syndrome, a rare autoimmune disorder in which the immune system attacks the peripheral nervous system, causing muscle weakness and paralysis. Tuberculosis, TB, an infectious disease caused by the bacterium Mycobacterium tuberculosis, which primarily affects the lungs but can also affect other parts of the body. Symptoms include coughing, chest pain, and fever. Huntington's disease, HD, is a genetic, progressive neurodegenerative disorder that affects muscle coordination and leads to cognitive decline and psychiatric problems. It is caused by a mutation in the Huntington gene, which leads to the accumulation of toxic proteins in the brain, resulting in the death of brain cells. Symptoms of HD typically appear in midlife and worsen over time, and can include involuntary movements, personality changes, and difficulty with speech, swallowing, and walking. There is currently no cure for HD, but there are treatments available to manage symptoms and improve quality of life. Amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease, is a progressive and fatal neurodegenerative disease that affects the nerve cells responsible for controlling voluntary muscle movement. The disease typically begins with muscle weakness, twitching, or stiffness, and progresses to more widespread muscle weakness and atrophy. ALS can also cause difficulty speaking, swallowing, and breathing, and ultimately leads to paralysis and respiratory failure. The cause of ALS is not well understood, but it is believed to involve a combination of genetic and environmental factors. There is currently no cure for ALS, but there are treatments available to manage symptoms and improve quality of life. Huntington's disease, HD, is a genetic, progressive neurodegenerative disorder that affects muscle coordination and leads to cognitive decline and psychiatric problems. It is caused by a mutation in the Huntington gene, which leads to the accumulation of toxic proteins in the brain, resulting in the death of brain cells. Symptoms of HD typically appear in midlife and worsen over time, and can include involuntary movements, personality changes, and difficulty with speech, swallowing, and walking. There is currently no cure for HD, but there are treatments available to manage symptoms and improve quality of life. Multiple sclerosis, MS, is a chronic autoimmune disease that affects the central nervous system. It is characterized by damage to the protective myelin sheath that surrounds nerve fibers in the brain and spinal cord, leading to a range of symptoms including muscle weakness, numbness, tingling, and problems with coordination and balance. MS can also cause cognitive impairment, fatigue, and mood changes. The exact cause of MS is unknown, but it is believed to involve a combination of genetic and environmental factors. There is no known cure for MS, but there are treatments available to manage symptoms and slow the progression of the disease.